Good morning, everyone. Today is a very interesting episode. In 85, we're going to talk about ADHD and microdosing psychedelics, part 1. Just so you know, I don't do that. I've tried it with the mushroom chocolate, didn't work. I tracked my progress, didn't work, so I'm not going to touch it anymore. There's no point. All right, so some studies by Vollenweider, which is a doctor, have found that psilocybin increases activation of frontal regions, the inferior and superior parietal corticals, and the striatum. Functional MRI studies using psilocybin reveal decreased activation. This decrease in activation is thought to correlate to ego-dissolution experience and to allow an unconstrained and flexible cognition. These two areas are part of the DMN, which I talked about before, which is usually the hyperactive in ADHD patients also. Therefore, psychedelics effects of decreasing DMN activity might prove beneficial in restoring the balance of brain activity in the network of ADHD patients. Psychedelics are also able to produce changes in brainwave as measured by EEG, and these studies also show evidence for possible compatibility of psychedelics and ADHD. Neurons that are activated by psychedelic drugs are thought to comprise of a small population, mainly in the medial PFC, which I talked about, as part of the basal ganglia, which are involved in attention and memory. I wish I have a brain picture to show you guys, but maybe next time. More specifically, the claustrum contains a lot of projections of brain regions such as the cortex and the hippocampus, and this high level of connectivity may act to organize and coordinate information from discrete network, especially from the cortical to the subcortical regions. Research has also shown that chronic administration, which I'm still looking up on that actually, of psychedelics leads to the downregulation of the 5-HT2A receptor, and that's the receptor for the psychedelics, a mechanism thought to account for the rapid tolerance that one can develop toward these substances. Now, moving on to serotonin, because they're kind of related, right? Serotonin is one of the hormones that interact with dopamine as well as norepinephrine. So many of the serotonin receptors that are activated by psychedelics are situated in the glutamatergic neurons. So glutamatergic. So a change in glutamatergic activity is also present. There appears to be an interaction between serotonin and glutamate in prefrontal areas. As a result of classical psychedelics, and these substances are able to exert strong effect on both networks. Glutamate is a main excitatory neurotransmitter in the brain and is responsible for communicating between different separate brain areas. Increasing the activity of this, for example, by using psychedelics, may result in greater network integration and global functional connectivity of the brain. Isn't that great? Glutamate is also associated with learning and memory, and more specifically with encoding information, which is NMDA receptors, memory consolidation and recall, and communication between neurons. Reduced functional connectivity in ADHD patients may also benefit from the glutaminergic action of psychedelics. However, there are obviously negative side effects to any drugs. The general use of supra-threshold psychedelic doses might result in unwanted effects, including triggering of psychotic states or increased feeling of anxiety or fear, and then increased heart rate during the trip itself. After the experience, the user may have perceptual distortion, or visual flashbacks, but these are usually subside with time and are not serious. Okay. A specific risk associated with psychedelic use, especially the use of LSD, is a chance of development of hallucination, persisting perception disorder. It involves the spontaneous re-experience of flashbacks or visual distortion that are characteristic of psychedelic state without having any of the substances in one's body, which cause significant distress to the patient. So now I'm going to talk about something that I've learned from people that did psychedelic. It's one of Joe Rogan's videos. And I've learned a lot. And I decided not to take psychedelics, not even try to go on a trip to enter my subconscious or to see if the center of my brain opens up so it connects the right and left, which methamphetamine, in my opinion, does do that, which I'm still waiting for the SPECT scan to confirm that for me. So when you're doing psychedelics, the most important thing is having a guide. You need to be in a very comfortable, very soothing environment. Know where that triggers your anxiety, panic attack, being nervous around people you don't know, or whatever it is. You need to be in an environment of calm, peace, serenity, as well as harmony. And you need a tour guide. I call it the tour guide. They call it the trip guide or whatever it's called. You need them to guide you. You don't just go on a trip and wander around. You need to enter your subconscious, and with the guide helping you, if you experience negative symptoms, they are able to distract that and bring you back to that subconscious knowledge or subconscious state of mind. So make sure that you always find a good guide, not a fucking drug dealer on the street. Okay, please, I beg you guys to do that, because there's still chances of overdosing psychedelics. I mean, I personally don't know, but I'm sure there's overdosing everything, and I hope everyone's safe. Stay tuned for the next episode, which is ADHD and Psychedelics 2. It's going to be a little more difficult also. So get your brain image or brain picture ready, and see you next episode. Bye-bye.